What's going on, you guys? Thank you so much again for tuning in. I am Eugene. Eugene does hair. We have Angela, Lady St. Lucia founder and creator, and our Dr. Assif today, who's going to talk about what people refer to as the vampire facial, which I keep hearing about. I don't know what it is, but it sounds interesting just because of the name.
Yeah.
And I know celebrities do it, and we see these little headlines with it. Doctor, what is it? How does it work? What is it? What is it?
Sure. Vampire face, of course. We call Kim Kardashian vampire face. It was there for a long time, which is amazingly, there's a lot of other treatments that are good, but they're not famous because still celebrities didn't get to those treatments. The time treatment that celebrity does it, everybody wants to do it. So let me talk what is vampire face. Vampire face, it's like they call vampire. It's like a bloody face.
Okay.
That's what it comes from, vampire. So your face become bloody, but it's not bloody. It's basically what we do. It's basically we take the first thing what we do. We take some 10 or 20 cc's from your blood. We withdraw blood from you.
Okay.
Drawing blood is number one. Then we took those tubes when we draw the blood from the tubes. Then we spin them. Spinning. We spinning at fixed, we call RPM. It has to be like you don't want to destroy them. It has the spinning has to be the rate of spinning very fixed. It's usually the laboratory, they give you those spinning tubes, and after spinning, what you get, because you get what we call platelet rich plasma, is like a gold, yellow, and in the bottom is red packed blood cells. So basically your blood has plasma and has red packed blood cells. So your blood, we get this plasma, which is what we call the gold, platelet rich plasma, because platelets in your blood is the one that, when you get like cut in your skin, it stops the bleeding. There's growth factors. There's a lot of good stuff in your blood. Remember, when you go for blood transfusion, they don't give you the whole blood. They give you what we call red packed blood cells. Because like, for example, Eugene or Angela, you go and you give your blood away. You know what we get from our blood? We get red packed blood cell that we give for transfusion, but also we get your plasma. With your plasma, we do a lot of proteins. We do a lot of coagulation factors. We do a lot of good things. When people, they start bleeding, like for example, they have some problem with bleeding or this, we give them plasma because plasma has your platelets, it stops the bleeding. But the good thing about this plasma that we got from your blood, it has growth factors. It's good for your skin, regenerate your skin. But also those growth factors, when we put them in there, they attract the stem cells. So they have a great, repair for your skin. It's like, that's why whenever there is damaged skin or something like that, or there is trauma, your platelets run to fix the hole, fix. So what we do, we cheat your skin. We give that plasma, and when you give it, so the body thinks you have a problem. Your stem cells, they run over there and start repairing your skin. And why we call it a vampire face? Because we add to it the microneedling. So we do PRP, we inject PRP and microneedling. Microneedling, it's small needle pricking inside your skin. It's a small, and everybody knows about microneedling. So what we do first microneedling, which is prick of small, tiny needles in your skin, which is cause some micro injuries to your dermis. And then we inject that platelet rich plasma. So what it does, your microneedling stimulates your collagen, stimulate your elastin, and we inject that platelet rich plasma, which is help to repair. So it's great combination for your skin. And lately it's been very, very popular as it's used in a lot of other things. So it's not just for the skin. And remember, platelet rich plasma, the first time was used in the NFL. because platelet rich plasma also used for ligament, for tendon. It was used for orthopedic surgery in the past.
Okay.
Because what it does when you inject it, it heals the ligament. It has proteins in it, and it attracts themselves. So actually, it was famous a long time ago. I don't recall which NFL player, but I recall that year that platelet rich plasma was very, very famous. They injected to an NFL player have some tendon injury, and he played the Super Bowl. 2 weeks after that, he played the Super Bowl, and he was okay. So for a long time, it was just for healing tendons, ligaments. But then all of a sudden, we start injecting it on the face, and we find out that actually it's good for your skin regeneration, for skin repair. It's unbelievable.
Okay, so Doc, real quick, who is there like a particular age group that's ideal for this candidate, or who would be your ideal candidate to receive the vampire face treatment? Can it be for anybody? Is it someone who might have just losing collagen in their face?
That's right. It's a very good question. The PRP is good for everybody, but it's amazing for young people, because young people, they have that very good, rich platelet rich plasma, very good protein. Is like nice. They look good. It's like stronger and muscular. Let me tell you about example. I had one girl lives in Long Beach. She's like a Gap model. She's in Gap. She's like 18 or 7, I don't know, 17, 18. And what is great about this, you can use it at any age. You start like 15, 16, because this is not plastic surgery. It's good for acne. It's good for a lot of things. It's good for, even 15, 16, 17, it's good for their skin. Good for, like I said, for acne, for a lot of things. So I have this Gap model, came at 17 years old. She has like a little bit of acne, a little bit, but they do makeup and all, they hide that stuff. But the thing is, she didn't want to use it. And I told her, she came one day to me and I told her, look, you are very young. I don't want to be doing, some kind of lasers and all that stuff. You are young. And I don't want any complication, because laser, whenever I do laser, it's small kind of complication. She told me, what is the safest way to do it? I told her the safest way is platelet rich plasma, because there is no allergies, because it's your own blood. There is no way you're going to be allergies to you. You're injecting your own blood. It's plasma, your own blood, so it's yours. The only thing, you have to be sterile. A risk of infection, of course. That's the only risk of a platelet. Of course, you have to be sterile. You have to be in good hands. Like, for example, I'm a doctor, I'm an anesthesiologist. Even a good nurse can do that. So as long as it's sterile, it's conditioned, it's great. So I told her, like, microneedling is the safest you can. It's microneedling because it's a poke in your skin. So it's like, that's the only way you can do for now. Let's try it. Be honest with you, I would never promise somebody's like, okay, you're going to look like the best. I don't promise much. I'm a doctor, remember that. I'm not a car dealer. I don't promise anybody, because I know about these things. When I give a treatment, 99% can work. I don't take that 1%. That's what we do for a living. We, as a doctor, I don't promise nobody. Even 0.0, I don't like 100%. It's like, let's try it. She tried it. She looks amazing. Amazing.
How long?
So she told me.
How long does it take to see results, and how many times would you have?
That's right. So the result is about a couple of weeks, about 2 to 3 weeks, and the best is 3 treatments.
3?
3 treatments. But guess, I have clients right now. They come once a month. They don't want to get out of it. So they look so great. They come once a month to do it. So every month. So like, I swear to God, there is one girl that was had laser, and she has a bad complication with laser. Like I said, remember we talk about this subject. Like a lot of people, they say laser. If you are in the wrong hands, the laser, remember, laser is a machine. Is the one who operate that machine. Remember that. I tell that to everybody. It's not like you doing laser it does the job for you. So if you get the bad setup, it's bad. It's not like when you work in like Eugene doing something with your hand, or me when I'm doing my hands. When I'm doing laser, I'm not doing anything with my hands. It's the laser doing the job. So if you are in the wrong hand with the laser, bad setup. So anyway, this girl got some burn, and we've been doing platelet rich plasma for it, and she loves it. She's like, every month she's coming, and she loves it. So let me show you, for example, this graph over here, if you can see. You see over here, for example, do you see my slides or you don't see it?
Yeah, we see it.
You see in here, if you see that in here, like you see that the dermis over there, the collagen over there. You see the ink blue where. See here how the look at the dermis in here, how big and thick comparison to the other one. Did you see that?
Yeah.
Yeah.
So that's after. So that's 4 weeks after. Look how it gets big and thick.
Okay.
So,
now,
yeah.
how long does the procedure actually take? If somebody goes into your office and does the procedure, how long does that take?
I would say about between half an hour to 45 minutes.
Okay.
Oh, that's okay.
Yeah. So well, just let you know, the PRP with microneedling is used also for a lot of things, not just for the face. It's for surgical scars. You know that, like if you have any surgical scars, like you can use it. It's really good for acne. Also used for hair loss. It's becoming good for hair loss. Angela, that it's very, very popular right now for hair loss because it grows your hair. So basically, it's done especially for women. For women, is their blood. Yeah, it can use everywhere.
Really?
And it's great for women because as men it's great, but like for example, you have to use it early, not like when all your hair loss. For example, for me, I don't know if it's gonna work the best, but for like somebody who's just like his hair is just like beginning like light, that's the best. For women, the best. Why? Because of the physiology. Because in guys we have what we call dehydrotestosterone testosterone in our scalp. So that dehydrotestosterone testosterone vasoconstricts is not good. So we get bald as men. That's why we get bald as men. So for women, they don't have that dehydrotestosterone testosterone. So most of women that they lose their hair is mostly hormonal. But this with PRP, it's great, amazingly great for women. For guys, like for example, it's Eugene has good hair in there. If he has a little bit of hair loss at some point, it's amazing. It's amazing. Like kind of it stops the hair loss. It grows. If you have that hair, it makes it really thicker, nicer. So it's used for also volume. Get your collagen. So it's great. Let me show you some picture. For example, see this lady, for example, up in the top. Do you see? Can you see it?
Yes.
Yeah.
So it does make your skin look like smoother, kind of. As you saw, like so basically, as you see in here, PRP also repair damage that that damaged tissue is over there. It does repair. You see, it's smoother over there.
Yeah.
And like, let me show you, for example, it can be done everywhere. It can be done in the forehead, in lower eyelids, in the cheeks, in the lips. It can be done anywhere that PRP. And you see like the injections why, and I'm saying like usually the way how it's injected, it's I do like microcannula to inject it. Some people use a small needle to inject it. Some people microneedling, they just put it topical, and you can inject it everywhere. So this is how it get injected. Like those are collagen in there, wrinkles, hyaluronic acids in there, and you inject it everywhere. A lot of people when they inject it with needles, it's a little bit called a lot of bruising. So what I do sometimes, I use the micro cannula. I don't use needles, or I just when I do microneedling, I put it topical. So you could see this lady a little bit. You see this lady in here?
Wow.
Again, you see in here, it's a little bit. It's very kind of
That's a big
very
difference.
nice. You see this lady a little bit for this. You see the difference?
Are these like one session's difference, or is this a series of 3 sessions?
No, most your best results in everything. I'd be honest with you, in skin rejuvenation, in everything you do, there is no one treatment. And the reason because the skin it takes at least 3 months to build up.
Okay.
So no one treatment is not. It's like I tell people when they come to me or my clients, it's like you have a plant. You know, you buy plant and you want to grow it up. You cannot just grow it up. You're gonna take time. You're gonna, you know, put some water, fertilizer. It's like it takes time to grow, because remember, this is your own. You're building your own collagen. You're building your own elastin. You're stimulating fibroblasts. These things, it takes time. It's not like you're injecting products, like for example, fillers, and you're gonna see it right away.
Okay.
It takes time to see the result that you do.
Okay, quick question. So for someone like myself, who you have treated with fillers and Botox, would this be okay for people that have had fillers?
Of course, this one, it's like I say earlier, it's fillers are great because a lot of, as we get older, like we say earlier, we start losing our fat pads. They start going down by gravity. So we give that volume, is us lifting your face. With Botox is amazingly good because it stops you from moving a lot your face so you don't wrinkle. So it prevents wrinkling.
Yeah.
Volume. But PRP and all, it's skin rejuvenation. It's make your skin look smoother. So like, for example, this lady, if you see in here, her skin looks more youthful, more nicer. What I see you. So for example, let's see. You have a nice volume, you don't have wrinkles, but if your skin doesn't look good, it's still something missing. Remember, looking good is package. It's like you're gonna go for vacation. You know, you may have a good flight, but the hotel is bad. Or may have a good hotel, but it's all the time good to have a nice smooth flight, nice hotel. You know, it's you know, everything it comes with the package. So when you treat your skin, it's good to have a nice volume in your skin. It's good to have less, you know, no wrinkling too much, but also you don't have bumps, like bumps in your skin. The only thing you can do like nice, smooth skin is with the skin rejuvenation. Okay. What is skin rejuvenation? Let me tell you, in your dermis, there is what we call fibroblasts. Fibroblasts are cells. We call them fibroblasts. And you stimulate this fibroblast, and this fibroblast is the one that release collagen and elastin. And this collagen, it's like a cushion to make your skin nice and smooth. When you start losing your collagen, you start having bumps in your skin. Like, you know, when you get older, you see people have bumps, not smooth skin. It's because there is damage of your collagen. So when you do skin rejuvenation, you do filler, you do Botox, it's give you the perfect, nice, plumpy skin. It's like you see those celebrities on TV. Like they have like, boo, like nice, smooth, no bumps, no that. And that's the perfect look that everybody's looking for.
I love it. Her results are amazing. Wow.
Yes, it's the Asian girl, like a little bit of, you know, it smooth up those wrinkles as you see in there. Is that you, Eugene? I see your face in there. You're a star or what?
It looks like, I mean, you took like 20 years off of her face.
Yeah. So you see these things like in the eyebrows like that. Like you see this lady, for example. Did you see that lady? You know, it takes kind of a little bit of so my point is it's amazing. It's, be honest with you, I personally, I don't treat myself a lot. I wish I treat myself. You know, every time I want to treat myself, I don't have time. You know, I try to treat myself when it's COVID-19. It's like, Nada, you know what? It's my time, myself, to treat myself.
Yeah, okay.
But be honest with you, it is a commitment. It's like you go into the gym. Like I tell people, you don't want to go to the gym once a month or twice a month. It's the same thing for skincare. You know, you gotta take care of yourself. You cannot just treat yourself once every 6 months. It's right. It's like everything else in life. You know, you go to the gym. You know, you cannot go like just once every, at least, 3 times a week. You know, skin treatment is not just once every year. You have to do at least something once a month. Like this time you do PRP, the other thing you do something micro. It's the way how it is. I know not everybody can afford it, But there is like, for example, microneedling PRP. It's not that expensive, so you can get it from everywhere, and but it's like Botox, you do it 3 times a year. Fillers, you do it once a year. So this kind of treatment, you do it once, twice. So be honest with you. If you see somebody there in their 50s and 60s and they still look good, because they take care of themselves. That's the only thing I can tell you.
What's the downtime for this vampire face procedure after?
Because you said there was a little bit of bruising. So like how long would the bruising show up?
The bruising, actually, like I say earlier, if you use a lot of needles injections, you're gonna get bruising. For me, I don't use needles. I use one entry point micro cannula. I go in there and I go with the micro cannula. So I don't stick the skin 20 times.
Got it.
And also those injections with the needle, they're really very painful for my clients. I did it once or twice. It was a bad experience for my clients. I don't do it anymore. So there is 2 things. Sometimes I do microneedling and I put topical PRP because those microneedling, the skin is still open. So while we do microneedling, I put that topical PRP and it goes inside. Or I do microcannula, the same thing I use for the fillers. I entry point with needle. I do in one entry point. I use PRP everywhere. Because be honest with you, sticking somebody like 40, 50 times in his face, you're not gonna come back to me for PRP.
Right.
Even you get good results, you're not gonna come back to me. Because people, even if they have great experience, one thing they remember the most is the pain. I can tell you this. The pain, people will not come back to you if they feel pain, even if they look good. So I try to do all my procedures, minimize the pain with great results. So some people, they may say, okay, I will look good. I don't care about the pain. A lot of people, I don't want to deal with the pain. I don't want to look good. I don't want to deal with the pain. And that's all the time in my clinic. I all the time try to minimize the pain. I try to make it as comfortable as possible so they can enjoy the results, but also they can enjoy the experience.
I can speak from firsthand experience that is very true.
Yeah. So, and also Angela asked me questions about, what's your question, Angela? You asked me a question before.
It was about recovery time. So is this little?
Yeah, recovery time, yeah. Actually, what is great about this one, recovery time is just, actually when you finish, it's like you were in the beach. Okay. So basically you can do it in the afternoon. The next day you are okay. It's just after that is redness. Nothing
now,
like.
Is this service only available in the Orange County location or in Riverside too?
For me, I cannot right now. I would love to open up a place in Riverside and basically take care of my clients. But this right now, I cannot do it in the weekend because like I said, 45 an hour. And usually when I go in there, it's like a little bit very busy in there and I can't do that. But if they come to my office in Orange County, I'd be happy to take care of them. And also,
now how far out are you booked for these types of services? For like this type of service, how far out would somebody need to schedule this?
You know what it is? Sometimes to call, I open up Saturdays sometimes. And Saturdays, I would book. It's just like, it gives me like at least 1 week, 2 weeks. It depends. Like sometimes it's busy, sometimes not busy. But, you want to do it, you call. And sometimes somebody call, cancel. We can fit you in. If it's not canceled, we'll give you the next week. But it's, I'm sure right now we're going to open. We're going to be very busy because there's a lot of people been waiting for this kind of things for a long time.
Yes.
So I would like, for example, I would probably call 2 weeks ahead because a lot of people, what is amazing, Angela, with this Zoom, everybody's seeing his face for 3 hours. Everybody want to look good. Like right now, I'm looking at my face. It's like, oh my God, I have some hyperpigmentation on the top of my head. I still look at it. I never seen it. I start seeing my face. I'm like, what damn? I was like, kind of fine, because all the time I'm with people. Right now, I start seeing my face like for 2-3 hours. And you won't believe it. People are calling because a lot of people doing this video war, virtual work at home, and it's going to be more of it. There's a lot of companies right now. They are actually right now they are going to be permanently working from home. So a lot of people, they're going to be in the Zoom. So anyway, you believe it or not, there are a lot of people calling for these kind of procedures, like looking good. They want to look good, and especially when they are seeing their face for 2, 3 hours, 5 hours on the Zoom.
Yeah, it can get frustrating. I know that one too.
Well,
Sheila, you look the best. You look the best. So
thank you. Thanks to you, doctor.
at least you look better than me. I don't want to talk about you. Eugene can't talk about himself. But you look good. You look great.
Thank you.
Well, doctor, thank you so much for, again, another informative episode. We do appreciate it, and all these episodes that you're doing with us. And we will have all your contact information listed so people can reach out and get those scheduled. And then we will be reposting for when you're going to be visiting out here in Riverside.
Yeah, and again, like people from Riverside, they are amazing people. I love them, and they are hungry for change. They're hungrier than Orange County. I think Orange County probably there's a lot of people in there, but when I go to Riverside, people are really hungry for this kind of treatment.
Yes.
Well, because Doc, we have to go to Orange County or we have to go to Los Angeles. There's not a lot of qualified people like yourself, doctors and physicians that are performing these. We have a lot of, nurses and techs that are, qualified to set up shop and work under a practitioner, but we don't have an actual doctor who, has full spectrum knowledge of everything out here. And so we do really need you out here.
Well, I'll be, like I said, I'll be happy, like I said, I found out like people in the Riverside, they are really, really interested. You know what I like about Riverside girl? They want to look good.
Absolutely.
They really want to look good. They're really, people want to look, they're people interested. I think people in Orange County, they have a lot of, they're busy with their money, I guess. The girls in there, they want to look good. Here, like people are like all the time busy, kind of, they don't have, but still, but also we in Orange County, we are like too many med spas, too many things, too many plastic surgeons, too many. So I think Riverside needs like this kind of treatments, and also, what it's amazing is, Angela, that the technology is out there. It's just you have to start it earlier. Don't wait too long till you are like 60 or 70. You start earlier, you're gonna look there.
Yeah.
And I have some great news for everybody out there. I have the latest technology in there. There is a lot of good stuff out there. I will we'll start with the basic, but we'll talk about some very, very interesting things in the future. Very interesting.
Awesome. Well, thank you very much again, Doctor. Enjoy your holiday weekend. Same to you, Angela. Enjoy whatever you end up doing this weekend. And until next episode, you guys, again, we appreciate all your love and support.
Happy Labor Day, and everybody, guys, and thank you for inviting me. Thank you.
Of course.
Thank you.
Thank you.
See you soon.
Please.